Good afternoon, ma'am. Ma'am, can you hear
Good
me?
afternoon, madam. Good afternoon.
Uh, Good afternoon,
Very good
everybody.
afternoon. Yes.
Welcome, everyone. I'm Dr. Hinduja, PG Part 1 student from Department of Repertory and Case Taking. I'm thrilled to see you all joining us today for this exciting webinar on a cornerstone concept of homeopathy, reflecting on a case from the locus of the repertory. I'm particularly delighted to introduce our esteemed speaker, Dr. Gognol Aarti ma'am. Dr. Aarti ma'am is the Vice Principal and HOD of the Department of Repertory and Case Taking at Dr. J.J. Magnum Homeopathic Medical College. And ma'am brings a wealth of experience to the table, having practiced homeopathy for the past 25 years. In today's session, Dr. Aarti ma'am will be our guide as we delve into our intricacies of using repertory's locus to unveil the unique characteristics of a case and pinpoint a remedy that most closely aligns with the patient's individual experience of illness. So get ready to embark on a journey of discovery with the Dr. Aarti ma'am. Over to you, ma'am.
Thank you for such a nice introduction. So I'm very much delighted and I am highly privileged for delivering this lecture to all the PG students. First of all, I would like to convey my thankfulness to the director, Dr. Manilal sir, principal, Dr. Venkatesh Rao sir, and obviously our HOD and professor of repertory department, Dr. Sneha madam. And I will be filling in my duties if I don't have any cooperation, and thankfulness to all my dear students. So I hope that this lecture will obviously enlighten you with a little bit knowledge. So related to this, reflect on the case in relation to the locus of repertory. Thank you very much. So shall I share the screen?
Yes, ma'am.
So just make me enabled for sharing the screen.
1 second.
So whether the screen has been visualized?
Yes, ma'am. It is visible.
So once again, I'm very much thankful to MNR Homeopathic Medical College for giving me an opportunity to share my views related to the topic webinar, reflect on the case taken from the locus of repertory. So just we will start this today's session. So the objective of this session will be that at the end of this lecture, the PG students will be able to understand case taking in homeopathy through repertorial approach. The students will be able to explain how each part of well-taken case can be utilized while searching for a simillimum in the repertory. So these are the objectives. So and at the end of this 1 hour lecture, so you will be able to learn this case-taking approach through the locus of repertory. As we all of us know that homeopathic physician requires sufficient tact and a mastery of technique of case taking in order to obtain all the detailed minute information of the patient as an individual. And the information so obtained is often a jumble, or it is a combination of various signs and symptoms. As Boni Gosani has said that case taking is nothing but the sum of objective and subjective symptoms. So he must have a keen mind and a sufficient patience to create an order from this chavos. And to achieve this, he evaluates each and every symptom according to the importance of the standpoint of the totality. After that, what the physician does is he synthesizes them according to a definite preconceived plan, which enables him to bring together these scattered elements together to evolve one characteristic form of an outline. So at this stage, one's interest should be to bold outline the picture of the patient, which corresponds the few drug pictures from the homeopathic Matra Medica, And once this is achieved, he looks around the certain details of the greater individuality on which this progress is continued till the image is unmistakably been pointed to one single drug picture. So this is the background of why we take a case. So essentially, there are three things or a merit for which a homeopathic practitioner he has to consider. So this is called as homeopath's trinity. So first is the case taking, second is the selection of the remedy, and the third is administration of the remedy. So we are not going to in detail the organon part, but today's topic is related to somewhat the case taking and the repertorial approach. But these three things are essential, as like that organon, matra medica, and repertory, these three-legged stools. So likewise, the case taking, selection of remedy, and administration of remedy is very important. And but majority of the students and practitioners, they are taking the case in detail, but they are not utilizing many of the points which are available during the interrogation through repertorial point of view. And that is what today we are going to learn through repertorial approach, how a case taking can be qualified, so that during case taking itself we didn't be able to convert this symptom into repertorial language. So well aware to that, if we are well aware with this various rubrics related to the captions which are taken in case taking, so that this job will be much more easy. So as we all of us know, we have learned right from second year the case taking importance, but just I will highlight on the point why there is a purpose of case taking. Because for any of the case introduction, this case taking is one of the important and a part. As we said, a well taken case is always a half cured. So purpose of case taking is to get a very simple language. In simple language, I will be explaining, is to get the knowledge of the disease you all of us know, to find out the totality of the symptoms for the selection of homeopathic remedy, to find out the nature of the disease, whether it is acute, chronic, curable or incurable, to find out the cause of the disease. Even Hahnemann, Boning-Hussein, Boger, right from Aristotle, they have given importance to the cause. So causation of the disease is also very important, and that we can only be achieved, or we can elicit, or we can glean from the case taking process. To find out the mode of development of the symptoms, how the symptoms they are developing, to analyze and evaluate the symptoms, to collect all the important symptoms which are necessary for doing the repertorization, to cure the curable and to palliate the curable patients by selecting medicine according to the law of similars, to give prognosis. Obviously, the purpose of case taking is, though nosological diagnosis is we are given homeopathic, we are giving least important, but it is also one part of the totality. So in short, I have just here highlighted the purpose of case taking. You everyone are knowing with it.
Excuse me,
The
ma'am.
purpose of repertory or the advantages of repertory, you all are knowing right from third year. But just a little apart from that, few points I would like to share. So repertorial approach is very much essential, because as we all of us know, the vast matra medica, it's very difficult to memorize all those recorded facts in all one mind. So that's why using repertory is one of the most essential aspect of practicing homeopathy. And even Hahnemann, he felt the need of compiling the indexing of the symptoms, which he compiled in his Fragmenta de Veribus Medicamentorum Positivis, second part called as symptom index. So he felt the necessity of indexing the symptoms, then why not we to utilize this repertory? So repertory
Excuse me, ma'am.
is like a storehouse of homeopathic data. It is an index which has been compiled to include symptoms and conditions according to the matra medica. So it is a tool that fixes most difficult of our cases, provided that one should remember that it has to be utilized in a very artistically and skillful manner. And this artistic way, how to find out this artistic way, is just by repeated practice.
Madam,
Yes.
Madam, just a minute. Your slide is not changing. It is same first slide.
Okay, but I have changed it, madam. See?
We can see only first slide, madam.
Oh God. Okay, just a bit. Huh?
Yeah.
I will.
Okay.
See? Now, purpose of repertory.
Yes, ma'am. Now we can see the next slide.
Yes.
Yeah.
Okay, sorry for technical. So repertory, as we all of us know, as is a tool which fixes most of the difficulty of our cases.
Ma'am, can you make it full screen, ma'am?
Yes.
Ma'am, it is not in the full view, ma'am, screen.
Screen is not visualized?
No, it's not in the full view, ma'am.
No, I have been there full view. Okay, just I will see from beginning. See, right now, see.
Okay.
See.
No, ma'am, it's near Boninghasen's approach only.
Purpose of repertory?
No, ma'am, it's not showing.
Why? But I will just share a screen. Like I will stop and once again I will share this.
Yes, ma'am.
See, right now you are able to visualize?
Yes, but can you make it a little bigger, ma'am?
Okay, but
Screen
while I'm expanding, it is, I think it is not able to visualize for you people. See?
Okay, ma'am.
See now?
Yes, ma'am. Purpose of repertory, I can see.
Yes, yes, good, very nice. So correct, homeopath should be knowledgeable and unprejudiced while selection of repertory, rubric, and remedy, and collection of all those facts pertaining to the patient, which will help to find out the summum. So correct prescription without reference of repertory is really impossible, highly impossible thing. So we are just incorporating the nearby areas which related to the topic. So now change the slide. Repertorization. Are you able to visualize this? Steps of repertorization?
No, ma'am. It is still in purpose of repertory.
Okay. So I will go for here only so that you will be able to. Okay. Now?
Yes, ma'am.
So repertorization is not a mechanical process. We all of us know it is not just counting of rubrics or making the total marks obtained. It also includes certain logical steps and it starts from the case taking itself. So the first step for going towards repertorization is case taking. And finally, we end up with the final court of appeal, that is Matra Medica. We all of us know. So this is the steps which we start, that is case taking, recording and interpretation. We define the problem, we classify and evaluate the symptom, we erect the totality, we select the repertory as per the case, and we do the repertorization chart, repertorization through techniques, different techniques. We come towards the repertorization result, and finally the analysis and prescription. So we all of us know there are three approaches, that is Boning-Hussain approach, Kent approach, and Bogus approach. You all are aware, as you are PG students, these things have been already been discussed in BHMS program. But yet I would like to highlight before reaching towards the core of the topic. So this is very much essential to understand, because as we are correlating the case taking and the repertorial approach. So we know this Boning-Hussain approach, it is based on grand generalization concept of or doctrine of analogy, what we say. Then Boning-Hussain has given importance to concomitants, prime importance to modalities. And finally, he has given least important to mental symptoms for final differentiation. Remedy relationship also he has given one of the most for which we owe to Boning-Hussain. Kent's approach is little bit apart different. He has given importance to mental symptoms, limited generalization, physical generals. He has given more important after mental generals than characteristic particulars at the final stage of differentiation. Bogus approach is like a mean to, he has given the bridge between the Boning-Hussain's concept and Bogus approach, where he accepts or he amplifies, it is an amplified version, what we can say, of therapeutic pocketbook philosophy, which he puts the data into a clinical field, and he gives one more term called as pathological generals, and even through which we can also come towards the simillimum. So final, all the three approaches are to just come towards the simillimum. Now coming to the core part, what we are going to learn through the case taking, through the locus of repertory. As we know, in case taking, we take those symptoms which are constant, frequent, strongest, and the most troublesome to the patient, and has to be taken, which has to be considered while taking a case, and locate such rubrics which are present in sections of repertory. You may use any repertory. You may use recant, complete, Boger, or synthesis, or synthetic repertory, or complete repertory. So through the case taking, we start with the preliminary data, where right from the preliminary data, the symptoms which we take during interrogation, they are all present in repertory. But our point of view of locating those rubric we are missing. And starting from the primary level, if we try to learn this case taking, or through the repertorization point of view, repertorial point of view, then we can collect various rubrics. Age related, suppose the preliminary data name, age, we have age related rubrics. Which are those? Like infants, we have rubrics. You take Kent repertory or a complete repertory, you have rubrics, or a nurse repertory, you have rubrics related to infant, children, adolescents, puberty, young, menopause, old age people, gender wise. So right from the beginning, your approach should be considering the rubrics for your further process of repertorization. Okay, so just taking the case, and finally when you come for the analysis, you don't have the rubrics in your hand. This is only possible if you don't have that approach of repertorial approach during case taking. And your case taking process will be qualified when you come for the final process of repertorization, if you start looking the case taking procedure in this way. Even in present complaints, if every symptom is related, or you can take any simple headache, or simple knee joint pain, or abdominal pain, or shoulder pain, or backache, you take any kind of pain or any kind of symptom, so you have to relate with relation to cause, location, sensation, concomitant modalities, because we have rubrics related to onset, progress, extension, alteration. Okay, so rubrics related to headaches, general injuries, mechanicals. So these are the few examples, just I have given a few in brief examples. Okay, even we have nature of disease like acute or chronic. Okay, so here even in presenting complaints, we find rubrics related to repertory. Now coming to the after present history, personal history. If you go for the personal history, you will find milestones like mind, talk, general, slow learning to walk, slow learning to children who are very slow in learning to. So if you take the personal history right from milestone, and if you get such rubrics, obviously you'll find rubric in the repertory. So your mindset should be like wise while taking only a case. Your approach should be like a through repertorial point of or locus of repertorial point of view. Even the occupation, we have many of rubrics related to the occupation, like emergency, stone cutters, ailments in constipation in sedentary habits persons, asthma from inhaling dust, arterial hives in on the skin due to cement work. Habits, if you see, there are various rubrics in repertory related to habits of alcohol, toxicity, tobacco, narcotic elements from. So these are the few examples. You will find much more if you try to search in the repertory. Now, in general, you will find meteorological time modalities. We have seen various repertories are also there related to the time modalities. Even in general sections, you will find all the rubrics related to food, desires, aversions, aggravation, and amelioration. Even in the rectum, if you see, start learning the rectum, stool, you will have many bowel habits, character of the stool, also urinary organs. You will, if you give the minute detail of the case taking, during case taking, you will find such rubrics under the urine. And sleep, many times the students under sleep, they don't mention anything. Very few students, they give the detail. If I ask to the students why you are not mention any kind of characters in the sleep, so they generally say there is no any important characteristic symptom in sleep. See, go for the position in the sleep, because when the person is sleeping, he is sleeping in certain position. There are various rubric. If you see in TPB, various prominent and typical positions in the sleep, they have been given: lying on right side, left side, knee, abdomen position, high, low, head, high position. So at least you will get the position of the sleep, even if you are not getting the concomitants during the sleep. So if you start in case taking procedure only itself through repertorial way, obviously you will find out n number of the characteristic and important rubrics, so that our final selection of the simillimum will not be missed out in future. Even in menstrual history, we find there are various sections related to female genitals. Menstruation is rubric, you will find the symptoms in case like taking, ask the question through to the patient, if female patient, what are the complaints before, during and after, what is the character of menstrual blood, what is the nature of the flow, whether these complaints are aggravated along with leukorrhea, go for any symptoms of white discharge. Same things, concomitants can be asked in menstrual history. Even in case taking only, if your work of repertorial approach is done half cured, you need not to be able to search where are the symptoms, where to look. Each and every part of the case has to be looked through repertorial point of view only. Obstetric history, even in the obstetric history, we have various rubrics related to obstetric complaints during pregnancy, miscarriage, abortion, varicose veins, pregnancy, female infertility, such kind of various rubrics we find in obstetric, we can find out in obstetric history if the patient is having such complaints. Even in clinical examination, we find like rubrics related to eyes discoloration around bluish, eyes blueness, acne, face. Just there are a patient don't be able due to shy or due to embarrassment. They are complaining of other complaints, but they don't tell the symptoms of acne over the face. But we as a physician, we are observing that the female or of a young person or young boy is having acne. So that you have to note down in the clinical examination. So each part of the particular examination also can help you to come towards the particular rubric which are present in particular section of Keynes or any other repertory, exhaustive repertory like complete synthesis. So these are various rubrics. If you go for section, make the habit of at least going through the repertory, you will be able to understand them. So there are various diagnostic rubrics. Even in generality section, you will find various diagnostic rubrics. So here are the few diagnostic rubrics. Now, coming to the part 1. So up till now, the first session we have completed related to case taking, how to deal with the repertorial way of case taking. Now, first in the first slide, I have told you age related also we have the rubrics. Suppose a patient approaches to you who is a 73 years old age patient, who is an old age patient. Now you consider that this patient is old age, and related to the old age, how your case taking approach gets diverted along with the repertorial approach, that we will see. So the repertorial, now we will have one part of that case taking, that is repertorial approach of old age related people. So how a case taking procedure in old age related people can be carried out or can be interrogated. So before that, you should have a sound knowledge of each and every field of medical science. Even we have learned in community medicine, what are the age related problems, what are the age related symptoms or the diseases, you should be able to know. It is not only the 3 subjects like organon, matra medica or repertory. You should be well aware with all this medical subject, right from anatomy till the community medicine. So in this slide is taken from community medicine park book, where there has been, we have learned in final year, age related problems are having problems due to aging process. These are the problems like glaucoma, osteoporosis, emphysema, failure of spatial senses, changes in mental outlook. So you should be well aware when approach of a patient is a old age, then your approach of a case taking should be likewise. So problems associated with long term illnesses, then like degenerative changes in heart and blood vessels, cancer are more prone in old age related patients. Diabetes mellitus was one of the commonest disease which is found in India right now after 40 years. And if after 70, it is much more commonly seen. Respiratory illnesses, genitourinary complaints, these are a long-term illness, or what we can say in a language of homeopathy, chronic illnesses which are dealt in old age related people. Psychological problems, mental changes or disorders, sexual adjustments, and emotional disorders resulting from social maladjustment, failure to adapt, can result in bitterness, can result in what you can say insecurity, being abandoned by their own children, feeling of loneliness, inner withdrawal, depression, weariness of life, even the suicidal tendency can occur. So only one single age, if you see, find the patient is of 73 years old. So all this picture, it has to be bear into your mind. All this picture has to be come in your front. These are the problems related, medical problems related to old age people. Now my case taking should be gone through likewise this repertorial approach. So how that we'll see. So I have just seen we have 3-4 problems related to age, like problems due to aging process, due to long-term illnesses, due to psychological problems, and social problems. Social problems, elderly people, many times we can see even in society, they are little bit elderly. People are getting abused. They are dependent on certain another person, their family members. So economically, they are not that much sound enough, financially sound enough. So those are also been related when the patient, we can see if he is of a old age people. So they need rehabilitation. So after all, if the patient is bedridden, obviously he has gone through various major surgeries, he or she has to be rehabilitated. Okay. Now, in relation to these problems of age, we have various rubrics in our case repertory. See, I'm correlating the medical books with the repertorial approach. That is case taking, medical books, and repertorial approach. So first, what we talked about was the rubrics related to the problems due to aging process. So here are the rubrics related to old age people. See, if you go through the repertory, you will find n number of the rubrics related to the old age people, like starting from head, eyes, vision, face, mouth. I will be not narrating all the rubrics. You have to go into the repertory and see. So rubrics related to problems due to aging process, heaviness of the head in old people. I am giving few examples. Cataract eye in old people, glaucoma in old people, hearing impaired in old people, dimness of vision in old people. So you can utilize this rubric. Yes or no? You can utilize this rubric. So mouth, paralysis, tongue. So this is rubrics. These are the rubrics related to the old age. See, I've gone through throat, speech, abdomen, rectum, chest, skin, generals are the last one. So we have n number of the rubrics related to aging process rubrics found in old age people. Now coming to the rubrics related to the problems associated to the long-term illnesses, as we have seen that degenerative diseases of heart and blood vessels, you have the rubrics. See, in chest, we have the complaints of heart indigestion in functional heart symptoms of old age people, complaints of heart in old people, heart myocardium, old people, pulse hard in old people. So all these are the degenerative symptoms which we can find it in a chest sections under degenerative diseases of heart and blood vessels. So correlating the medical science along with the homeopathic subject is very much important, and having a view, bird's eye view of repertorial approach, obviously it will help you to come towards to one homeopathic single simillimum, which will obviously help to cure the case even the patient is in an old age. At least you are not able to cure, you can even palliate the patient and you can give the quality life to the old age people. So cancer, in cancer we have the chest cancer mammary in old people, cancer mammary old people in middle age, chest cicatrices old in mammary, nodules mammary in old people. So these are the cancer related in old people. Even accidents, I have given problems related to the old age. In accidents also we have diabetes, we have, and diseases of locomotor. Just excuse me one moment. Sorry. So diseases of locomotor we have seen. So respiratory illnesses. So all these rubrics are related to the old age people. Genitourinary system, like symptoms related to the prostate, bladder, and kidneys and urethra. So all these rubrics we find. Okay, so we'll be not going one by one, but just I'm able to show you that there are various rubrics related to old age people. So this is what looking a symptom through a repertorial point of view. So rubrics related to psychological problems. See here, So first we have seen mental changes. What can be a mental changes in a old age people? See, we find a number of the rubrics like absent-minded, weariness of life, confusion of mind, alcoholism, dipsomania in old age women with asthma, childish behavior in old people, confusion of mind, delusion, imagination, he looks like dreams of the people in old people, mistakes make. So these are n number of the rubrics which we find related to the mental changes of the people. Related to the sexual adjustment in old age people, we have mind lasciviousness, lustfulness, old people with enlarged prostate, male sexual system, ejaculation, seminal discharges frequent in old people, troublesome erections in old men, troublesome violent in old men. So these are the rubrics related to the sexual adjustment which in old age people they can come through. Emotional disorder, sadness, despondency, fear, forgetfulness, forsaken feeling, desire to go home, loathing of life, increased sexual desire in old people. So these are the various rubrics related to old age people. See, we have seen only one part of the case taking, that is old age people. We found n number of the rubrics, such a vastness of matra medica and such a systemic order placement in a repertories we can find. So now, as we have talked about the old people, so coming to the third scientific session of this is that we will be dealing with one case of, as we have talked about the old age people. So today we will be dealing with one case of old age people. Okay, so that's why I've gone through this case, as we have talked about the repertorial case taking and repertorial approach of old age people. So we'll be dealing with one example of this case of old age people. So this is a case of mononeuropathy. Hope you people, you have learned in medicine what is a mononeuropathy. It is one of the complication which can be seen after a prolonged diabetes mellitus, where you can find there is what you can ptosis or drooping of one eyelid. Okay, so here a 73 years old patient presented with the complaints of redness of eyes, and there was first he felt a certain redness, then gradually there was a pain little bit around the eyes, followed by drooping of one eyelid, and that was on the left side. That is what we say in a medical term as a ptosis. He has had this complaint since past 8 days. So since past 8 days, this complaint started gradually, and then he developed this symptom of dropping of eyelid. So there was a history of uncontrolled diabetes. When after this symptom, when the blood sugar level was checked, it was around 312 milligram per deciliter, and when hemoglobin A1C, that HbA1c was done, it was more than 10, and it was 10.5%. So due to which he ensued, or the result of this was that he ensued the symptoms of third cranial nerve mononeuropathy, that is oculomotor neuropathy. There are various also other what you can say diseases due to which this drooping of eyelid can occur, like myasthenia gravis or any kind of tumors which, if it is present in the optic nerve opening, even we can this symptom. But as he was having this long standing and uncontrolled diabetes, he was being diagnosed as due to diabetes mellitus, he got this symptom of mononeuropathy. So he's on diabetic anti-diabetic tablets, but along with that, due to speed up the cure, he was also advised to take homeopathic treatment. Obviously, if such patient comes, so it's my humble request that don't stop the allopathic treatment immediately. So let the according side by side we can utilize, or you can prescribe homeopathic treatment or auxiliary homeopathic treatment too. Okay, so he was also on the anti-diabetic tablet previously also, but yet he got this symptom. Obviously, why not to give homeopathic treatment? So that was the thing for which he came for the homeopathic line of treatment. So the totality was elicited was so I have just cut short. I have given the cream of this case, not I have gone through all the procedures. So I will come directly to the totality. The totality elicited due to the knowledge of repertory or knowledge of rubrics and the way of case taking through repertory approach, I was able to find out the totality immediately. So that is the one advantageous point. If your case taking is through repertory approach, you can easily find out the totality with respect to the repertory language. So the first rubric which I found was affectation. So affectionate is different and affectation is different. Mind well, my dear students. Affectation is pretension, is said to be the pretension. So now what was the case? How he was pretending? So even though the physician, even though the attendants, they were knowing that the eyelids, one eyelid he was not able to open, but he was saying that I'm okay. There is nothing happened to me. I'm okay and I have no any symptoms. It is just my eyelids are not opening for a few days and it will be okay within 2 days. So that pretension that I'm okay was a need of the person. Actually, the symptom is there, but he's pretending as if he's something, having something else. So that is the meaning of the rubric affectation. Doing pretension is a affectation. So right during the case taking, the symptoms which he was repeating, and that found me this symptom has to be taken and that symptom has to be converted, and that symptom which was rubric which was come forward was the affectation. So he was pretending that as if he has had no any complaints and he's already all right, and he has no any uncontrolled sugar, and it is just a matter of few days and I will be able to open my eyelids, sure. But it was a little bit it was seen by the physician. Even it was been consulted to neurophysician, and it was diagnosed as case of mononeuropathy. Apart from that, he was pretending himself as if he is okay. So this rubric affectation was taken. Other physical generals, when it was seen, it mental generals was, he was having one symptom was hurry. So whenever he came for the consultation, he was always in hurry. Even the attendant, if they were asked, that he is always in hurried mood, and that thing rubric was also characteristic during mental symptoms was elicited, and this rubric was taken. Physical generals, like he was having desire for sour food, there was weakness while walking, and that walking was aggravating his complaints of knee pains. He was having a chronic complaint of constipation or difficulty in stool, which was taken, and constipation of old people. Obviously, the for which this complaint the patient presented to us was falling of leads. Obviously, always remember for which the symptoms are most uh, problematic to the patient, that symptom has to be taken into your totality. And likewise, we have taken this symptom, even though it is a particular symptom, it has to be taken as it is a characteristic symptom of a case. Falling of leads was taken, falling of leads, especially on left side, it was taken, and paralysis of leads was taken. After repertorization, I would like to show this in a large view. After repertorization, all these rubrics were covered by one rubric, one remedy, that is alumina. The other auxiliary remedies were conium, natramur, sulfur, sepia, and naxomica likewise. But alumina was thought of prescription because it covered all the symptoms, as well as it has also obtained highest mark, that is 15/9. Now, what happened? So I would like to say here, sure that he was also on antibiotic hypoglycemic therapy or anti-diabetic treatment. Even before, he was a known case of diabetes since 10 years. Since 10 years, he was on hypoglycemic therapy, but he developed this symptom. So that's why other homeopathic line of treatment can also be adjunctly given along with this modern system of medicine. So on 13th April, alumina 204 pills BID for 4 days was given, and SL in liquid form. As he was a diabetes, I didn't thought to prescribe in a globule form. So SL was given in for 8 days. Along with that, he was advised for eating an healthy diet, regular physical activity, as well as exercise. Patient is also on hypoglycemic therapy. Dietary counseling was also done. And here we can say a slight improvement is been seen. As actual, if you go for the medicine of this particular disease, this mononeuropathy has a slow and steady cure. But here within a, what you can say, month, we have ki baba, yes, now his prognosis is little bit good one. We can't say that the prognosis is bad, because now he is able to open little bit eye. At least 20% of opening of eye is seen here. So on 20th April, when he came once again, he got this symptom after opening of the lid, a symptom of double vision. As we say that the eyeball has been controlled by the oculomotor nerve. So that's why the little bit weakness in that nerve still is there. So that's why eyeball movement is still impaired. And that's why the symptoms of double vision were started. And this diplopia was taken as a rubric. And after doing the repertorization, entering this rubric diplopia, the rubric sulfur came further. So as sulfur, constitutionally also it matched to the patient. So that's why I thought to prescribe the sulfur 200 stat dose. And now he's with this SL. So he was given sulfur 200 stat dose on 20th of the April. Now the patient is recovering. Hopefully this mononeuropathy case is has to be covered till 3 to 4 months. So if your quality life of the patient has to be increased, then 3 to 4 months से पहले अगर आप आपके पेशेंट को नॉर्मल फेज में लाते हो, तो इट इज ऑल्सो अ गुड थिंग. Or it is the homeopathy can also work in such kind of complications related to diabetes. So here we have tried to give you the approach of a repertory in case taking. So right from beginning also, if your eye, or if your approach of repertory is in a repertorial rubric way, obviously the totality formation can be easily known to you for final analysis. Hopefully we have come towards the last slide. So the last slide, take home message, I would like to share with you. A mastery of spatial technique of case taking and repertorization is very much essential for successful application of the concept of individualization, which is a very basis of homeopathic practice. And this can be only achieved by repeated practice of case taking. It means the more number of the cases you look, the art and your skill will be increased. So this technique, but right from the beginning, if you have the approach of repertory, obviously the final result will be very hopefully very useful for curing the patient. Second is knowledge regarding all the branches of medical science, and thorough knowledge regarding case taking and repertory will help in the repertorization. I have shown you this case of old age people. So this was one case of mononeuropathy. You can treat any number of any type of disease patient in old age people. So now Ayush system of medicine has come up with the homeopathy line of treatment for old age geriatric patient. You can also develop your own geriatric OPD of homeopathic through homeopathic way. Geriatric homeopathic practice you can develop. You can compile, or you can, if you study these rubrics minutely, this is the only one case. If you start taking a case of old age people, so the symptoms of these rubrics you will get repeatedly, and you will be able to find out this cure in your patient. So this knowledge obviously will help you to come towards the cure of geriatric patients. We therefore conclude that efficient training of case taking interrogation and eliciting totality, along with the knowledge of repertorization in different methods and of different standard repertories, will obviously have to be ensured in any performance of will have to be ensured in any performance of homeopathic education if it is to prove successful. So with this take home message, I would like to conclude this topic of reflect on the case taken from the locus of repertory. So if you have got any queries, so you are free to ask the questions.
Yes, ma'am. Ma'am, we'll get back to you.
So you got it, na? How we proceeded the case through repertorial approach. First part we have learned why case taking, how the case taking has to be approached through repertorial way. The second part, one entity of old age people. I've taken only one entity of the old age people and the rubrics related to the old age people, and I have shown you one single case of old age people. So likewise, you can take many number of the old age people cases, even it may be a diabetes or it may be of, as I've told you, chronic illness, age related illness, degenerative illnesses, or mental or social complaints. So any kind of questions, you are free to ask me.
Yes, ma'am.
Or any projection for the any which slide which has not been understood, I can come back to the particular slide. So here I am able to, I think you will be able to search the simillimum from repertory by proper search of rubrics. And this can be only done with the proper case taking only. So skillful interrogation and artistic case taking will help you to arrive to a proper correct rubric search in the repertory. Any questions or shall we conclude?
Ma'am, our thesis does not have so
Yes,
far.
yes, you can. Yes.
Ma'am, so far we do not have any doubts till now.
Yes, yes, I'm not able to hear.
Ma'am, so far we not have any doubts.
Okay,
Right.
so far you don't have any kind of doubts. Very nice.
Yes.
That means you have understood properly. Yes or no?
Yes.
Okay.
It's very
So
clear.
let me know ki, right from today onwards, huh? See, right
Ma'am.
from today onwards, what take home message you have to go is that any single case, it may be acute or a chronic, your view of case taking has to be related to the repertory. It is people generally, student what they do, the case taking part is different, and then rubric search is different. They do likewise because the rubric which you are taking is from the case taking itself. So if you are well aware with the rubrics, where they are being found, in which sections they have been found, in which repertory, which type of the rubrics they are found, if you are well aware previously, if you have got this knowledge, which is the must know part of your knowledge, which is must know of the part, then obviously your art of case taking and knowledge of case taking will be improved. And that correlation, if it is been lacking, and hopefully we are in failure in remedy selection. Are you getting me? And whoever the best practitioner, if you take in any of the part of the world, you see one common thing in them is that they are very well versed with the rubrics and the repertory. Without the aid of the repertory, without the help of the tool of the repertory, you will not come to the accurate or exact simillimum. Are you getting me? So if you have a proper hold on this subject repertory and the rubrics found in minds, generals, and particulars, obviously your case taking procedure will be like very easily, smoothly you can conduct this case taking procedures. So so it's my humble request or to the students of any, it may be a mathematical student or organon students. So as this topic comes under 80, that is advanced teaching in the fundamentals of homeopathy, please, it's my humble request to the students of Organon, Mathematica, as well as repertory. Don't ignore or don't underestimate the other subjects. It is the conjointly these subjects, if it has been utilized in your case taking procedure, obviously you will not your what you can say your work will not go in vain. Obviously, you will find out at least not the most similar. You will come towards the near to the similar remedy which will palliate the symptom at least. So knowledge of all the subjects, case taking, proper way of case taking, repeated as case taking, along with the repertorial approach, obviously will help you to reach towards a correct simillimum, which is our final aim of homeopathic practitioners. So herewith, I conclude my today's seminar or session or a lecture. Once again, I am very much thankful to the MNR Homeopathic Medical College Director Dr. Manilal sir, Principal Dr. Venkatesh Rao sir, and Professor of and HOD of Repertory Department Dr. Sneha madam, and all the students who are uh, hearing me. So thank you for giving me an opportunity. Thank you. Good luck for your future.
Thank you, ma'am. On behalf of every PGs at MNR Homeopathic Medical College and Hospital, I would like to express our gratitude for your outstanding presentation on reflecting on a case from the Locus of Repertory, ma'am. Your in-depth knowledge and experience are in the utilizing of repertory locus we are evident throughout your presentation. We would particularly appreciate the clarity and insightful details you provided, which effectively illuminated this cornerstone concept of homeopathy. The way you dealt this topic with the clarity and focus on the topics like importance of case taking and the purpose of case taking, importance of repertorization, various approaches of Dr. Bonninghausen, Dr. Kent, and Dr. Boger, and the repertorial approach to old age related people, and dealing with various rubrics while taking the case from repertorial point of view, and the rubrics related problems, and with the long-term illness of old people, and also a case of mononeuropathy, has given us clarity of understanding the concept of this presentation, ma'am. And it would not have been possible without the foresight and support of our director, Dr. Mallal sir, and principal, Dr. Venkateshwar Rao sir, and our PG coordinator, Dr. Tamil Selvan sir, and our head of the department, Dr. Sneha ma'am. We're confident that knowledge you shared will have a lasting impact on their ability to select the most appropriate remedies for their patients. We are grateful for providing us with this extraordinary opportunity to learn from a renowned expert like Dr. Aarti ma'am. We look forward to the possibility of collaborating with you again in the future and continuing our journey of exploration and discovery together, ma'am. Thank you so much, ma'am.
Thank you. Thank you very much. Thank you very much. Very nice, Doctor. Thank you.
Hello, madam.
हा मॅडम झालं. नाही झालं ना मॅडम.